Hey everybody, Lori Broccoloni here. I found this article from the horse and I can't use my, what's it called, Snipply anymore. So, let's go back. So, I'm going to do videos. Anyways, happynaturalhorse.com. Lori Broccoloni here, helping you keep your horse healthy and sound and happy, saving you time and money and heartache mostly. So it talks about the NSAID drugs. Are they helpful or harmful? This is the main two that vets use for pain and inflammation besides steroids, fighting the arsenal, but sometimes they do more harm than good, which is true, especially after long-term use. So it talks about anti-inflammatory properties and what happens when you take them. So these drugs act as an inhibitor to the enzyme, I can't say the COX, which is two major forms of enzymes, COX-1 and COX-2. Plays a role in housekeeper. COX-1 plays a role housekeeper in regulating many of the body's process. But notably, it acts as a stomach mucus lining, protecting it, producing and to maintain the blood flow. So this is a prostaglandins are natural chemicals in the body's response to regulating blood flow. You have to remember, blood needs to flow in order for the body to heal. So, in many tissues, the body produces two, chiefly in response to the inflammation. And two classes of the NSDs are available to target these direct enzymes, non-selective COX inhibitors and COX-2 inhibitors. So what it's saying is, this is what happens when you give bute. So it's non-selective inhibitors are similar. Yeah, they do not discriminate. They target both of them. Okay, so decreased inflammation is significantly, but at cost at inhibiting the COX protective mechanisms. So, yeah. So, possible side effects, jugular vein thrombosis, gastric ulcers, everybody knows, kidney damage, and right dorsal colitis. And I just had a customer, as we scroll down, I'll show you what she uses. So, here's the famous one, Equine, and it's a selective 2 inhibitor, but its primary uses for arthritis, chronic laminitis, and chronic bone injuries. And minimal right dorsal colitis causes have occurred, which means your horse stomach will become inflamed. So there's always, on drugs, there's always a side effect that's going to be affecting the horse. So, you don't want to use long term, and you want to make sure that you, this they injected, I don't know, into the skin, and it formed this blood clot. Awful. And then there's the ulceration and the right dorsal, and then the kidney damage. So it says, when do you use it? You use it immediately when there's damage. Just for a day or two until you get your vet out there. And Toxemia or bacterial sepsis infection in the bloodstream. And this can occur, this can occur with severe colic lesions such as intestinal strangulation, which is awful, or a bacterial periodontal infection, inflamed mediators, results of fever, depression, dehydration, high heart rate. So, if you have this, it's best to go to the store and get some alum, A-L-U-M, and give a teaspoon to your horse once a day. and that will clear out the blood. It won't kill the infection, but it'll at least clear out the blood and get the blood pH where it needs to be so that you can give it the antibiotics that you need or whatever it needs to get rid of it. So when not to use it. So you use it on the onset of the stuff, but you don't use it for long-term use. So when not to use it. You don't want to use it if you have gastric ulcers or colitis. So essentially you rehydrate horses that are receiving blood work, do your blood work. And, but, you know, is there other things you can do? Yes, there is. So let me find it. It's right here. So in my book, Natural Equine Remedies, we talk about, this is laminitis, but some owners use cortisonoids as Prec or Dex or powerful anti-inflammatory drugs, but they also block the action of insulin and constricts the blood flow, which you need blood to the hoof in order for it to heal. So it can cause a healthy horse to founder and a founder one to become even worse. So in this article, and for some reason that link works, it talks about that. And so, you know, it talks about the drugs that go to cold weather may be team approach, treatment. Every cause is slightly different for laminitis, but where does it say about the drugs? Get expert help, of course, from your vet. Use pain medication. It's controversial. It says pain medication does not stop laminitis, it only masks the symptoms, which I believe. While pain causes stress in both horses and owners, it is important to acknowledge that pain has important function. It prevents the horse from moving around during periods when his feet are in jeopardy, causing rotation of the coffin bone. The pain is not the enemy. Gravity is the enemy. The best position for a horse with acute is lying down off his feet. Removing pain medication may be the best thing to encourage your horse to get bed rest he needs. Bed deeply and keep your horse friend close to help, and so your horse feels comfortable and secure. So, so it says, get it tested for sugar content, even if your veterinarian prescribes short-term medication and attempt to limit inflammation. Always confine the horse and always keep pain-killing drugs so moving around does not cause more damage. And then find the cause. So, but basically we're talking about pain medication, okay? So, if you have chronic long-term pain on your horse, you know, not basically laminitis, but that's where I put the butte thing. And let me go down here. So there's a lot of things you can do. Our laminitis protocol is in there. It's from I think the 19 or early 1800s. It's homeopathic, and it works really well. Aconite works very good. Here is the remedy here. It's also the remedies on my YouTube channel. So, anyways, sorry about that. So let's go down here. I had it down, but it goes back when the links work. So, talks about ting points, testimonials. I have tons of testimonials. How I've helped so many horses. Books you can get. Okay, so here's the homeopathics, and you don't want to use any of these links because I don't think they work. Apis is great for burning and swelling. Arnica is for bruises and aches and pains, physical trauma. Let's see, anxiety, rutagra, Nox vomica for nausea and heartburn, arseum, and that is great for symptoms of wide range of digestive disorders, anxiety, allergies, insomnia. Calichlor is an affinity for the bones, teeth, skin, connective tissues. This is what you use most of the time in the laminitis protocol. And homeopathics are not for long-term use. They're only like 5 days on, 5 days off. They're not, they're just for like for butte, and they were like a quick go-to. So you use it to remedy something, and usually I use it 5 days, 6 days. The calichlor you can go 30 days, but and only like one or 2, 3 pills a day. But you don't want to use homeopathics for long-term use. What you want to use is good minerals and herbs. Herbs work the best. Cayenne is great to give for the flow of blood to the head to the feet, so it's equalized. I always tell people give, if you got laminitis, get 20 to 30 cc's of apple cider vinegar, put the hottest cayenne that you can get, 1 tablespoon in the syringe, and syringe it into that horse every hour on the hour. If you on the onset, and you can use a little bit of Epsom salt in there too to help. Ester C is great for the nervous system and improving the immune system. It also is good for healthy skin and maintaining collagen. So nettle is really good for inflammation and heals wounds. And you can give that in a dry herb or make it into a tea. Or you can add it to your apple cider vinegar mixture with the minizyme, and that will help too. MSM is great too. And they use that for osteoporosis. Now remember, the butte blocks a lot of this, so you can't give herbs and butte at the same time. Yucca is another good one for treating stiffness, mild pain. It's really good for that. And so is chia seeds are great for magnesium. Have a good source of magnesium in there. Let's see what else we got. Thyme is great for inflammation of usually the respiratory. I would just and turmeric. Turmeric is really good. So you want to consider using herbals at a daily diet. We use the minizyme for the arthritis. We add it to the apple cider vinegar mineral mix, and that helps a lot with arthritis. So just wanted to share with you the side effects of using NSAIDs. I don't know how you say it. NSAIDs. Butte and so toxicity with NSAIDs is increased in animals off feed, dehydrating, critical ill. You definitely don't want to do that. So you want to take the less approach, which is just keep your horse on a natural diet. I use the Stanley Timothy hay pellets and Big Sky Minerals solves like 90%. It reabsorbs the calcium phosphorus ratio, and it helps keep your horse healthy. It really does. So, but I'm just saying you can add herbs and homeopathics for pain instead of using butte on long term. We're talking long term. Okay? Hope this helps. Please share. Please comment below. And have a great day. HappyNaturalHorse.com. Share this video and subscribe. Thank you.